Hi everyone. So I'm just going to be talking in general about how healthcare and the access of healthcare to undocumented populations, particularly right now on a policy level, and once we get into the breakout sessions we can talk much more in depth about how it affects our particular work, our particular centers, and strategize what we can do about it. So similar to the ways in which non-status immigrants remain hidden from public view to avoid detention and deportation, so too are the health costs and social implications of housing a population of 500,000 people in Canada. Similar to research with other marginalized groups in society, undocumented immigrants have numerous health needs that are just simply not met by our current healthcare system, especially in regard to mental health services and hospitals, which are rarely, if ever, offered to this population. Moreover, the needs of non-status people are frequently ignored by mainstream health professionals, most of whom are simply not trained to respond to such concerns or are ill-equipped to do so in terms of financial and institutional barriers. So financial barriers would be the fact that under our current healthcare system, healthcare service providers, particularly in hospitals, are not able to serve undocumented people. Institutional barriers include community health centers, for example, that simply cannot bear the financial cost because the demand far outstrips their resources at the current time. In general, I wanted to kind of focus on the idea of health security, which is referring to the concept of personal safety, protection from health risks, and ability to access health care in a safe and timely manner, which amongst non-status residents isn't simply extremely precarious like you see with other marginalized populations, but is simply non-existent currently. Non-status people have no access to healthcare services in terms of emergency needs. The most that can be done is through community health centers currently, who are so strapped for resources that they're forced to prioritize things like whether or not to take in a child to do a checkup or whether or not they're going to provide prenatal care to a pregnant woman. And these are the real barriers that we're seeing today. The reason why there is no health security, to be perfectly frank, is the result of public policy prescriptions, which serve to effectively and systematically bar non-status and undocumented people from accessing municipal, provincial, or any federal resources, as access is directly contingent upon being able to provide that you do have proper documentation and status. Consequently, what we see in terms of physical health repercussions is that non-status residents have extremely high rates of illness and hospitalization because of their lack of health insurance coverage, which prevents them from receiving health care when smaller health concerns arise. So how high is this rate? In terms of comparisons with the population at large, we see a 263% increase in higher rates of illnesses and hospitalizations among undocumented populations. So that's not, double or triple the rates of hospitalization. That's a 263% increase. Furthermore, non-status immigrants, in terms of when they're hospitalized, have significantly higher incidences of being hospitalized for far more serious and life-threatening concerns than conventional migrants with legal status. This is largely attributed to the fact that undocumented people fear accessing vital services such as healthcare because of the palpable fear of detention and deportation. In addition, the cost of healthcare acts as a serious deterrent since non-status migrants simply are expected to pay out of pocket for any and all costs, and as a result are generally at a pecuniary disadvantage. So what does this mean? When non-status people try to access services for any kind of emergency, you're looking at costs that often, for the first time around, exceed $50,000. If you're looking at any form of treatment in terms of cancer, for the first 3 months, you are looking at upwards of $200,000 out of your pocket. For a family that subsists on less than minimum wage, that lives in abject poverty, that simply lives below the poverty line, not just in this province, not just in this country, but within the confines of the city, to ask for payments of upwards of $50,000 to receive any form of medical care is simply nonsensical. They cannot afford it. And although refugee claimants, many of whom are non-status despite their formal correspondence with the government. Most people have this idea that, you know, if you have some kind of formal correspondence with the government, if you have certain applications in the system, that somehow you have status. That's simply not the truth. But even with refugee claimants who are technically eligible for some health care coverage under the IFHP, which is the Interim Federal Health Program, such coverage is woefully inadequate since it covers only essential services and often fails to even do that. And a recent study that was conducted found that 70% of theoretical beneficiaries, so those are people who technically are eligible for coverage under this program, reported not having access to health care to which they are currently entitled to. 70% also said that they had no idea that they were even able to access these types of services. Another reason non-status residents are unable to access health services and have higher rates of serious hospitalizations is due to the lack of health care service providers, most notably in hospitals and smaller health institutions, which are subject to treat and serve such populations. And as I mentioned earlier, it's just simply because these facilities, especially CHCs, which are community health centers, are just inundated with more non-status patients than they can accommodate. I've just been told I have 2 minutes left, so I'm just going to cut it a bit short. I wanted to give some actual quotes from people that were interviewed in terms of accessing healthcare services who are undocumented. And one of the most striking things that a woman said was, sometimes I feel I just don't have the right to feel sick. I feel I don't have the right to live. The nurse looked at my immigration papers like giving them a second thought about giving me any form of medical attention. I felt much discrimination about it. I feel my health didn't matter to people. And this is what our current system does to people. It simply makes people feel that their health concerns don't matter, that whether or not they live or die simply does not matter to us as healthcare providers. And I think that's a gross system that allows people to be subject to these types of feelings. In closing, I'm going to say that in terms of policy implications and recommendations that would ensure better health security and well-being for undocumented people, there are several things that are on the table. First, exclusion and marginalization of non-status peoples occurs within a specific social and political context that privileges certain individuals' human rights and well-being over others. This type of framework only creates a false dichotomy this type of framework creates a false dichotomy of us against them, where the other, which is so-called the illegal or the undocumented, is separated by those rights and privileges that are systematically denied to them. To ensure that mental health, well-being, and most importantly, health security take precedent, undocumented people cannot be forced to work and live in the shadows of fear and insecurity and should be granted full immigration status. If we are to ensure that people have access to services, we cannot simply do band-aid solutions. At the crux of the issue is the fact that people do not have status and are relegated and marginalized to the point where they cannot access basic services. And in second, in order to address the fear that undocumented people are confronted with on a municipal level when trying to access services, health policy should be devised so as to ensure that immigration status not at any time be a prerequisite for receiving help and access to essential services. This can easily be done by implementing a Don't Ask, Don't Tell policy, which is in effect in over 40 cities in the US. This policy would prohibit health and essential service providers from inquiring into an individual's immigration status in order to provide them with a vital service, such as health care. Also, in the event that providers inadvertently become aware of a person's immigration status or lack thereof, they'd be barred from disclosing this type of information.